My name's Dr. Keenan Grenell, and I'm a consultant here at SDC. People know me as Doc. Several people call me Dr. K. And some people just call me, hey, guy, how you doing? I've experienced COVID firsthand. I lost my father due to COVID, and this is the honest to God truth because I've just recently seen his death certificate. 2 lines. One said respiratory, the other one said COVID-19. My dad was my buddy. My dad was the one person that I could go and talk to about anything, regardless of what the subject matter was. A lot of men don't get a chance to say anything positive about their fathers because they're sometimes without dads. And if they do have their father at home, then they're sometimes often tension. I can't say that. I can't say that. I wasn't there. I wasn't able to hold his hand. I couldn't tell him goodbye. I couldn't pray with him. I couldn't be there for his transition because not only did he have COVID, but because of the restrictions that disallow anybody to go into a hospital facility if you were not an employee. I've lost a brother-in-law. I've lost a first cousin. I've lost close friends. I've lost individuals that I've gone to high school with. When COVID claimed my friend Edward Bryant, we lost a husband to someone. We lost a father to several children. We lost a colleague. I personally lost a fraternity brother. I lost a friend. And we lost someone who was a champion of Black economic development in this community. I've had COVID before. Matter of fact, it happened during my father's homegoing. At least 11 people in my family tested positive several days after his funeral. And let me tell you, that disease is nothing to play with. And I still have what you would call long-term effects. I have problems breathing. I have problems smelling. I have problems with attention span from time to time. And as a consultant, it is so incumbent and it's so important for me to be sharp and to be razor blade ready to be able to engage. But sometimes I have to step back and get myself together before I can even perform my duties as a consultant to this organization. So it's personal for me. What I want people to do is to realize that life is precious and that they are important. Every SDC employee is important to the larger Milwaukee County, and therefore it is imperative that every SDC employee gets a vaccination. And so what I'm expecting people to do is after they hear me, after they see this, they will tell themselves, regardless of what issues I might have in terms of whether or not I have issues with the efficacy of the vaccine, or if I just don't believe in vaccinations, I don't even get a vaccination when it comes to the flu. I want people to know this is not the flu. The flu kills, but this is Armageddon. And if we don't do something about it, we're not going to be around to share and tell stories to future generations. We have an opportunity here at SDC. We have an opportunity to go and be on a list. I mean, I can't even begin to tell you how important it is for the entire community to become vaccinated. And we can't be leaders in the community if we don't step up to the plate. We're a major social service agency. People are counting on us for 41 plus programs. They're expecting us to be alive and well and to be able to carry out and be functional in our capacities as leaders in this community. We can't do that if we're not around. Life is mandatory. And it's mandatory that you protect yourself, not just for you, but for your loved ones. It's nothing like having a conversation with the funeral home, talking about preparing for someone's going. It's nothing like being quarantined for 2 weeks in your home. and you can't be with your loved ones. It's nothing like knowing that you might actually suffer from long-term effects of this disease. If you don't have COVID and you have a chance to become vaccinated, that puts you ahead of the ball game. Don't let that chance go by.